Hi everyone, welcome to Southwest Fertility Center's Father's Day special. Infertility, or the trouble in getting pregnant, affects 1 in 8 couples. It is extremely common, but often couples are hesitant to even seek a basic evaluation as to why they're having trouble, just because there's so much emotions involved. Now, my name is Dr. Vinay Ganala, and like I said, I'm here from Southwest Fertility Center, so welcome to our Father's Day special. Larry, as I mentioned, that there's a lot of difficulty and emotions just seeking that first evaluation. So, tell us a little bit about that kind of journey of you and Jenna, and was there any kind of hesitancy in even seeking an evaluation, and what was that like for you guys?
It all started with me. I had a vasectomy from my previous marriage, but when I met Jenna, and I knew she wanted to have a family, and I was open to it. I've always wanted more kids. I do have a 22-year-old son, and he's fantastic, but I wanted to give Jenna everything she's wanted, and as a husband, I feel like I should be doing that. So we went through the process of, okay, well, what can we do? And we sought out getting a reversal. That seemed the most logical thing. I was like, okay, let's get a reversal. So we went and we sought out the doctor. There's one in Tucson. A lot of that, I wasn't too familiar with how it worked and how small these tubes actually are to get reversed. It's the "in God we trust" on a penny. It's the O in the God is how big that tube is. Mm-hmm. I had no idea what that. It was never explained to me until after the fact. So right. The reversal kind of took, but it was still very frustrating. And I started going to your office because I had to give samples in your fantastic little sample room that you guys have to that doctor so they can analyze it and then tell me what I need to do, more medication or more icing and this and that and blah, blah, blah. And that's when we started going to your clinic full time.
Right, and when I first met you, you showed the pain in your eyes because you are so much you want to help your wife. And I think you were blaming yourself, but that's not always the case. It just happened to be a factor, mm-hmm. But you were strong, giving it the support, but you really went through a tough time of how to help your wife until you had the success. Mm-hmm. And that was not easy. I remember seeing you, and you were there to do anything possible to help your wife.
Right, and she was such a trooper through this thing as far as medications and everything that she needed to be taking, but as far as it wasn't ever my fault. She never made me feel like I was the reason that this couldn't happen for her. And it's always been a partnership between both of us. And she's been fantastic in that aspect throughout this entire process. So
it's so important when a couple are faced with this problem, not to blame anybody.
Exactly.
Because it's not in our hands. Mm-hmm. It's 50-50. 50% is male, 50% is female. But you should not blame each other. And I know men have sometimes hard time accepting it, or even to commit to do a testing until woman completes their battery full of testing. So, but you were there for a whole year. Mm-hmm. I see your list of all those different visits. It was, impressive to me. Right?
Thank you.
No, I think, as we said, when you're actually looking and breaking it down of the causes of infertility, whether male or female, obviously multiple more things can be happening on the side of a female, but mm-hmm. 30% of cases are pure male factor. And fortunately, Jenna was young and had a great egg count, but you guys fell into that kind of 30% bubble, which was a pure male factor, mm-hmm. but there was never one moment, right, where she was, saying, oh, I'm here and taking these injections or doing this egg retrieval or doing these things because of you. You guys were such a partnership and a team, and I think truly that's what allowed us to go through that treatment and go through the journey and with happy outcomes.
And you guys were very upfront with everything. You're like, look, you can try naturally. It's not going to happen. It's not going to happen easily.
Right.
And you guys were very upfront with us. You were very honest throughout the entire process, throughout everything. We're running these tests because of this, or we're checking for this, or oh, we're trying to do that. And you guys were very upfront, very honest with everything. That's one of the things we loved about your clinic. That's why we came back.
Thank you.
and I think also in terms of kind of treatments of male factor, we do have limitations. We have a great treatment for it, and that's IVF with ICSI, or taking an individual sperm and putting it into each egg. But outside of that, there's intrauterine inseminations. But even with that approach, you still need, more than 10 million total total very good motile sperm, right? And so numbers are important for conceiving in nature with IUI. And although IVF is great, that obviously has it's a lot more invasive and just requires more,
And there's so many different factors that go into the male aspect of it. It's like, it's okay, no alcohol, no drugs, not that I'm doing any of those things, but also your diet, your exercise, everything affects it. And I was completely blown away by how much this little thing or that little thing can throw your numbers off completely. Because I was going to you guys for like a year, so I was playing with it. Let me see what I could do if I do this. How badly does it change? Yeah. I was like, okay, so that got worse. I'm not doing that anymore. Or it's so many different things can go into it, and it's so frustrating as the guy to be like, okay, look, I can't make this work the way it should work. And thankfully, you guys are there. You offer a solution to this type of a problem, and we couldn't be more thankful for both of you.
I mean, the male infertility is a multi-system disorder. It's not just one. It's like, when they have a sore throat, you go to family doctor, they do throat culture, give you penicillin shot. But here, it's a whole process. So it's such a detail-oriented field. And like Vinay said, 50-50. But we have to take our time, complete the evaluation, and we address from medical, surgical, emotional, most important, nutrition, lifestyle. Like you said, lifestyle is very important, whether it's male or female infertility.
I think also that's important just because you're optimizing what you can control. There's a lot that we can't control. We can't control what the eggs are going to look like. We can't control how the embryos are going to develop. All we can do is make it the best environment for that to happen. And when you can't control a lot, then what you can control, you want to make sure that you're doing perfect. But I think you guys did amazing with that journey, and obviously then we've now come back for, if you don't mind me saying that, we've come back now for baby number two, and we recently put back a frozen embryo transfer from our second cycle of IVF,
Yes.
and now we're currently 20 some weeks pregnant, right?
23 or 25.
Perfect.
Wonderful.
She keeps better count.
Yeah, that's not your job.
Congratulations.
Thank you very much, and it wouldn't have happened without either one of you.
No, I mean, this is the best Father's Day present you could have.
Yeah.
Second one on the way.
This boy and a girl.
And boy and a girl. You completed your family. 2 boys and a girl. Right.
And hearing kind of what, and now going through that journey of being that support, and we felt it as a staff of every single visit that you came in, it was like, how can I make this easier for my wife?
Yeah.
That I think team approach is what allowed us to continue with that journey even after kind of we didn't have success with our first embryo transfer after our first cycle. Where did you kind of get that strength from, and what do you think you would tell other couples kind of going through the process?
I supported her as much as she supported me. She didn't blame me for any of this, and we're a team, and that's honestly how you have to approach it.
Yeah.
You guys are working for the same goal,
Yeah.
and you can only accomplish that as a team.
Exactly.
So I support her as much as I possibly can because I have to be the rock for her. She needs to see that I'm with her and I'm behind her, no matter how horrible things turn out when we lost the first one, or how successful they are when we had Luna. And it's ups and downs, but you take it both together and you work together as a team.
Yeah.
And I think that's one of the great things about your clinic is everybody's part of that team. You guys make us
right.
all feel like you guys are all trying and praying and doing whatever you can to make this happen for us.
Absolutely.
So, and
it is for sure, it is a teamwork. Not one person can do it. Not just physician can do it.
No.
If I'm a surgeon, I can do my surgery. That's all. It's all me. But fertility is not just me. The whole team is important to have a success.
I think the amount that we ask of patients to come in for blood draws, for ultrasounds, all of these visits, that makes it so, it's time intensive, it's emotionally incentive, and if that fertility center is not providing that support and that backbone from every single visit, from every single patient interaction that they have with the staff, then that person's not going to want to come back, and they're not going to have a less pleasurable experience that I think can also ultimately affect their outcome as well.
And you guys were always good about answering, why am I coming in for this? What are we doing now? Or in this, and you guys were we're testing for this, or we're like during the retrieval, we're trying to make sure that we can trigger you so we can get the most out of it. And it's all answering every single question that we had. It's just been a phenomenal relief and off of our shoulders to where, okay, I understand what you're doing now, it makes sense. And the drive is horrible from where we live, but completely worth it.
It is.
I remember one moment vividly in our second cycle of IVF that we had responded, I think, better than the first cycle, very well. And the embryos were doing great. And I know we were kind of hoping for a fresh transfer, and then we saw you guys both on day 5, and you know, the evaluation at that time was where there was some kind of mild symptoms of ovarian hyperstimulation, and we could have transferred if that's what you wanted, but it would have been kind of safest for Jenna and just safest for a better chance of pregnancy if we let her body kind of calm down and do a frozen transfer. And I remember when we were talking about that, where you came for a transfer for a chance of a pregnancy right then, and I was giving information of, you know, that we should delay things a month or so, and you guys, you looked at it and you said, well, if this is what you recommend, we trust you, and we went for it, you know, and then obviously it stuck.
You guys definitely know what you're doing, and we have 100% trust in you and your facility.
Thank you.
I mean, you guys.
I mean, we do in a Southwest Fertility Center is an individualized approach. It's not a cookie cutter protocol. Each couple are evaluated, and the treatments are tailored to them. So sometimes my consults take hours. I know I make you guys wait forever in the waiting room, but you know, I'm taking. Everybody needs. Sometimes I have to, you know, we have to give more attention, but what I'm saying is it's an individualized approach. I think that helps our success rates.
Right. I mean, I think, you know, unfortunately, one of the things which is this, you know, is that IVF, or not even IVF, but fertility treatment has come very much like an assembly line of this patient comes in regardless of what their thoughts are, regardless of what their finances are, regardless of what their wishes are. You know, they do this, they freeze, they genetic test, and then they, you know, maybe do an ERA, and then they put the embryo back. But everybody does the same, and that may work for some percentage of patients, but that doesn't work for the difficult cases. And so you have to kind of treat everybody individually, not only in just, you know, how you deal with them, but their physical treatment needs to be tailored to them.
And you guys listened to us as well.
Absolutely.
And it wasn't like, oh, hey, look, we need a break. Let her body calm down, let her get healthier after the retrieval, and let's do a frozen one as opposed to a fresh. And you guys did take our opinions and what we wanted to do into consideration as well.
That's right. And then, you know, for you to follow the instructions or follow the advice, which is very important too. Sometimes they don't. Sometimes they know, they get so disappointed, we want to do it now. So, you know, you trusted and you trusted in us, and then decisions we all made together.
Was there any moments in the journey, I'm sure there were, but where we didn't want to continue, or what was
I
your
think we
guys'
were both
approach?
very determined to get this done, and she is much more of a trooper than I thought that I would ever be. She is so strong, Jenna. She is definitely the strong one in a relationship, because I'm like emotionally breaking down, saying, I can't keep sticking you with this needle. I can't keep doing this to you, but I need to do this to you. We need to make this happen. The end is worth getting to. And
that's right.
And the end makes you forget about maybe not forget of every one of those injections, but it makes you not think about them as hard.
especially her, she signed up for another one, so she's a lot stronger than I ever thought she'd be. Not that I think she's weak, but
but you learn a lot about each other.
Completely. And we definitely know that we are there for each other, strongest and in our weakest moments.
That's right. It's important that couple, they have to be together to achieve their goals.
Well, Larry, thank you so much, and obviously happy Father's Day for your second Happy
Thank you very
Father's
much.
Day, and the new one coming, and we can't wait to meet the new bundle of joy and the new boy.
Oh yeah, thank you both very much.
Very happy Father's Day.
Oh, thank you guys.
Thank you.